Hi, I'm Steve and welcome to 4minds. Today's video is what is bipolar? Bipolar is a mental health condition formerly known as manic depressive disorder. It is a condition that affects your mood going from one extreme to another. The most common side effect with bipolar is depression, from going from extremely low or lethargic or just getting thoughts of suicide. The mood swings associated with bipolar does go from one extreme, not just with depression, but with something called mania or hypomania. But each mood swing could last a few hours, days, or even several weeks. A person with bipolar is normally diagnosed with clinical depression first, before getting diagnosed with bipolar. Now on to the other half of bipolar, which is mania, which usually sends the person into an overactive state. Usually kind of looks like that person is happy or over energetic, and they kind of get sometimes over ambitious. A less severe version of mania is called hypomania. It's similar but nowhere near as erratic. When a person with bipolar is overcome with this mania, it can, like I said, be overactive, happy, even thinks that bipolar or the mania is a positive thing in their life, which of course it isn't, because the person can get annoyed easily, usually triggering the depressive side or sometimes aggression. But a person with this disorder can go on an absolute rampage, usually overspending, talking quickly, just changing their plans and going out and do strange things because of the state that they are in. It's usually to do with the adrenaline surging through their body when the balance in their brain switches to one extreme to another. And of course, after they've been in this state of mania, they basically crash and go on a state of depression, usually with suicidal thoughts. And yes, it does interfere with daily life. You never know if your body, or your brain, is going to go into this either mania or depressive state. It normally just comes on, because a normal mood for a person with bipolar isn't normal. It's always changing, I guess you could say. But bipolar is fairly common, with 1 in 100 people being diagnosed with this condition in the UK. And it can occur at any age, but usually between the ages of 15 and 19 is when the majority of people are diagnosed with bipolar. But strangely enough, it is extremely rare for a man over the age of 40 to be diagnosed with bipolar disorder. And some people can get 1 or 2 episodes in their entire life of bipolar, if it's the manic depressive state or the mania state. But for some people, it can be every day or every few days and so on. But there is medication for bipolar disorder. From my research, it doesn't seem like a lot of people get a combination of drugs, either antidepressants and a mood inhibitor combined. It's usually one or the other, or an antidepressant with some sort of mood stabiliser in it, rather than 2 separate drugs coming together. And therapy can help talk you through it as well. They suggest that you have to try and recognise triggers, what your body is responding to, if it's the depression side or the mania side of it. It's helpful to try and find what triggers it, and it could be absolutely anything. You just have to basically find it and either work through it or avoid it. But what can help with recognising the triggers is a sense of achievement. I thought it was kind of bizarre reading that, but it kind of naturally increases your adrenaline, peps you up a little bit, rather than your body just switching extremely quickly. And with every single mental health disorder, you diet, exercise and see your GP. But the causes, unknown, like everything, but the most believed ones are stress, overwhelming emotions or problems, life-changing event, and genetic and chemical factors, which all of it can be helped. Nothing is permanent. At least I hope so. Right, that's it for this video, and I'll see you next Tuesday at 8 AM. Bye. I will be doing a video in the future of what to expect when you talk to your GP on various different mental health disorders, because it's all different. Usually you just have to basically spill your guts to them, and sometimes you get like a questionnaire to fill out, usually depicting what your mood is currently and overall on the average 2 weeks.